Where does lung cancer commonly metastasize in the body? Lung cancer has a sneaky way of spreading beyond the lungs, which can make diagnosis and treatment more complex. When lung cancer spreads, it's called metastasis, and it happens when cancer cells break away from the original tumor and travel through the bloodstream or lymphatic system to other parts of the body. Understanding where lung cancer tends to spread helps doctors plan better treatments and gives patients a clearer picture of what to expect. The most common places where lung cancer spreads include the bones, liver, brain, and adrenal glands. These organs are rich in blood supply, which makes them prime targets for circulating cancer cells. For example, when lung cancer spreads to the bones, it can cause pain, fractures, or other complications. Bone metastases are quite common and can significantly affect a person's quality of life. The liver is another frequent site. Metastasis here might lead to symptoms like jaundice, which causes yellowing of the skin and eyes, or abdominal pain. The liver's role in filtering blood makes it a common landing spot for cancer cells traveling through the bloodstream. The brain is also a common destination, especially for certain types of lung cancer like small cell lung cancer. When lung cancer spreads to the brain, it can cause symptoms such as headaches, seizures, or neurological changes, depending on the location and size of the metastasis. The adrenal glands, small organs located above the kidneys, are also frequently affected. Often, metastases in the adrenal glands do not cause symptoms unless they grow large enough to press on nearby structures. Lung cancer can also spread locally within the lungs, affecting other lobes or even the opposite lung. Additionally, it can spread to nearby lymph nodes, which is important for staging the disease. When cancer spreads to distant lymph nodes or other organs, it indicates a more advanced stage. It's important to remember that even if lung cancer spreads to these organs, it remains classified as lung cancer. The pattern of spread can vary depending on the type of lung cancer, such as adenocarcinoma, squamous cell carcinoma, or small cell lung cancer. Small cell lung cancer tends to spread more aggressively and often involves the brain and liver early in its course. Adenocarcinoma, the most common type, frequently metastasize to the bones, liver, and adrenal glands. Symptoms from metastasis depend on where the cancer has spread. Bone metastases may cause pain or fractures. Brain metastases can lead to neurological symptoms like weakness or speech difficulties, and liver metastases might cause jaundice or abdominal discomfort. Sometimes, metastases in organs like the adrenal glands do not cause noticeable symptoms and are only found through imaging tests. Diagnosing metastasis involves imaging studies such as computed tomography scans, positron emission tomography scans, bone scans, and sometimes biopsies. These tests help determine how far the cancer has spread and guide treatment options. While metastatic lung cancer is often not curable, treatments like chemotherapy, targeted therapy, immunotherapy, and radiation can help control the disease, relieving symptoms, and improve quality of life. Understanding where lung cancer tends to spread is vital for both patients and healthcare providers. Early detection of metastasis can influence treatment decisions and help manage symptoms more effectively. Every patient's experience is unique, and the pattern of spread can vary widely. Regular follow-up and open communication with medical teams are essential for managing the disease. In summary, lung cancer most commonly metastasizes to the bones, liver, brain, adrenal glands, lymph nodes, and other parts of the lung. Recognizing these patterns helps in staging the disease accurately and planning the best possible treatment. Always consult with healthcare professionals for personalized advice and the latest treatment options, as each case is different and requires tailored care.